So, in terms of disparities, I found through some research papers that the disparity here would be a socioeconomic / income conditions would result in an increase or were really directly related to the number of diagnosed type 2 diabetes. So specifically the groups that are affected by this disparity are the low income individuals, because they are infectedly unjust. They are affected unjustly because they cannot afford to eat healthily given their circumstances provided by the community. So say the individuals here, so researchers have also found that the number of individuals who are living under poverty conditions will, like I said, result in a higher increase of type 2 diabetes, right? A fact here is only 11% of adults in food-secure households self-report a diagnosis of pre-diabetes or diabetes. This graph here shows, I wasn't able to put this on my PowerPoint because I couldn't copy and paste, but this PowerPoint shows that there's a disparity among the number of individuals who live under poverty conditions as an income level, and they're showing the disparity between the amount of food they have, and another graph shows how their income level is affected to the levels of diabetes. I have that attached in my PowerPoint. So we go back to this. So stakeholders. At the individual level, the individual is continuing their problem because their income is fixed due to their socioeconomic status. So in other words, they cannot improve their levels, their lifestyles because of their income status. They're limited to what they can and cannot afford because of their income. Therefore, what they cannot and can't eat, or what they can or cannot live by, determines that they're more likely or less likely to have type 2 diabetes. At the organization level, we can prevent this by saying that the organizations can provide healthier options to the community, but at the same time they can also continue this problem by not caring about the health of others and about making more profit to their interest than the health of the community. At the community level, we have the community can help treat type 2 diabetes by having the individuals and organizations work together to solve this public health threat. However, the community can allow this problem to continue by permitting the individuals to live under their socioeconomic conditions. Is there any progress? Oh, yes, there is, actually. In one study, researchers attempted to address this issue by reducing dietary variety and concentrating intake on a few inexpensive, calorie-dense foods will allow adults to meet or often exceed their daily caloric requirements while spending less money on food. So in other words, they can meet what their diet needs are without having to spend as much in eating healthier foods. This is my reference, just in case, where I got my data from. Another study showed that there were local neighborhoods and local governments agencies have been working together with grocery chains and wholesalers to attract business to areas with a relative paucity of nutritious food options. and that's my reference. So in conclusion, we have, I find it important to address this issue that type 2 diabetes is increasingly a public threat to the Merced County. Not only does the system composed of individuals, the community and organization need to work together in order to make this go in reverse, but if we allow the individuals, the community, and the organization to work together, we can move the rate at which diabetes is growing to reducing it, to further improve the social and economic conditions that are highly affecting the individuals today. Thank you.